WellPoint is so excited to be here and to be part of the XPRIZE. As Peter mentioned, many of you may not have heard of WellPoint. We're actually the largest health benefits company in the country with 35 million members, and our mission is to improve the lives of our members and the health of our communities. And the XPRIZE really fits in so well with that mission, and we're a very mission-driven company. We at WellPoint recognize the burning platform of our current healthcare system and recognize that it's not sustainable. And that's why we believe that insurers, government leaders, consumers, providers must all work together to find ways to innovate. And so that's why we think the XPRIZE fits in so well, because we need to find real-world solutions. A lot of times what is developed and what's come up with, conceptually is great, but then you start to get real providers and real patients trying to deliver care, and things don't work. Let me just set up the problem in terms of some statistics in our healthcare system. And when I say system, I use the words in its broadest sense, because I think we would all agree that the healthcare system we have today is not coordinated, not integrated, and doesn't have those aspects that when you think about a good system, it really has. So about 50% of the time when you go to see the doctor, chances are that the care that you're getting is not in accordance with best practice. So, go see the doctor, get some recommendations, flip a coin whether or not what is being recommended to you is what you should be getting. If that doesn't scare you, it should. It really should. There's huge variation in care provided across the country. So, for example, you go to the doctor, you have a headache. Depending on what your community is and what the practice is in that community, you may or may not get an MRI, you may or may not get a lumbar puncture. There's huge variation in whether or not you're likely to get a test, depending on where in the country you are, without any evidence base behind that. Like also, if you're in the last 6 months of life, how many days are you going to spend in the hospital? There's up to a 6-fold variation depending on which community you're in. More than 130 million Americans suffer from at least one chronic condition, and that number continues to rise. And that's not sustainable when we talk about the effects and the cost it has on our healthcare system. 31% of US children are either overweight or obese, leading to an epidemic in childhood diabetes. So while we're working with leaders in Washington to develop healthcare reform that's productive and forward-thinking, the Healthcare XPRIZE allows us to look at totally new and innovative ways to address the problem. Innovation is a hallmark of our choice-based healthcare system and is a key differentiator of WellPoints in the marketplace. We are also committed to testing the solutions that are come up with, the 5 finalist solutions, and I'll talk about that in a minute, in our various marketplaces. So it's not enough to come up with a concept. It actually has to be built, has to be tested, piloted, and then finally implemented. So a few the demographics of the prize. It was launched in April and has gotten a lot of attention so far. We're currently seeking comments and feedback. We've received over hundreds of comments to date, and then hope to craft the prize so that the final design is launched in the fall, at which time teams can apply. The plan is to take all the comments that we're getting currently, as well as the expert advisor input, to craft the final design. The goal is to move our current healthcare system from the very reactive, provider-focused system to one that's proactive, with a focus on wellness, with a focus on health, and that is very patient-centered, so that we can engage and motivate our healthcare consumers. We want to change this from a sick care system to truly a healthcare system. So how are we going to measure success? Ultimately, we're going to look at whether the winning team can create an affordable health system that engages individuals and results in the optimal health of the community. The winner will have to implement a solution that leads to a 50% increase in healthcare value. And we're defining that as the health of the community divided by the total cost of healthcare for that community. And we're going to be developing what we're calling a community health index to measure the health of the community overall. And they'll be doing that over a 3-year period. Then each of the 5 finalists that get through the pilot stage will be given a community to work with, or will be picked by a community, and we're still working on those details. But it'll be about 100,000 individuals, give or take, and they'll either be geographically clustered or they will belong to a self-insured employer, and that they will have to implement their solutions within that community. They should develop and implement a systematic approach to engage, coordinate, advise, evaluate, and influence those individuals and their providers. So some of the things that they might look at is creating a single point of accountability for health, increasing care coordination, developing new payment models that move providers from volume to value, developing healthcare transition programs as you move from one setting of care to another, creating new ways to help people know and understand their individual health status, the creation of individual health vitality programs, developing information technology that enhances patient-physician communications, or new types of incentive programs to encourage patients and consumers to really engage in their health. This is also going to be a very transparent process. So we're committed to making all the solutions public, sharing the results so that everybody can benefit from what's determined. And we're also committed to implementing the winning solution within WellPoint itself. So this is just one of the examples of the innovative programs that Anthem at WellPoint is working on from a collaboration perspective. We're also doing a couple others that I'll mention just as examples that might be considered as part of the XPRIZE. Something that is very popular within the healthcare industry today is something called the patient-centered medical home, which is looking to change the way that primary care is delivered. I mentioned that only 50% of the time when you go see the doctor are you getting the right care. The patient-centered medical home is designed to really flip primary care on its head so that teams of care are operating in an evidence-based fashion and giving an individual the care that they want as opposed to what the doctor thinks they should have. Anthem Care Comparison is a program we have that looks at transparency. Basically, when you go into the doctor or when you need a procedure in a hospital, you have no idea what it's going to cost. And what Care Comparison does is gives you an idea ahead of time of what the average hip replacement surgery at this hospital in this community is going to cost. And so from that, you can figure out what it's going to cost you and if you want to go someplace that's more expensive or someplace that's less expensive. We also have a very innovative partnership with Latts that takes advantage of current social networking trends and collects information on feedback about various providers from the actual consumer and the patient who's seeing them. Another example is our HealthCore Safety Sentinel system. And this is a system that takes advantage of the massive data set that WellPoint has. With 35 million members, we have an incredible amount of data, among the largest in the world. And what we do then is we can screen for side effects of new pharmaceuticals, new drugs that come out in the marketplace. For example, you might remember about 10 years ago, there was a drug called Vioxx that was a painkiller medicine out in the market, and it was found to have very harmful effects, and a lot of people were harmed by this. We've estimated that if our Safety Sentinel system had been in place at the time that Vioxx was out, we could have determined the harmful effects 3 to 6 months sooner than it was actually discovered by the FDA. We're also looking at a partnership with a hospital in Ohio called Kettering, where we're combining our claims data with their clinical data. Because really one of the huge powers in healthcare is data, and data at the point of care. And so by combining our claims data with clinical data, we can give more data and information to consumers and to providers to provide better care. So we've partnered with the XPRIZE Foundation because of its proven track record of soliciting and implementing exceptional solutions to national and world challenges, and our proven record of innovative collaborations. And we're very excited and look forward to discussing more with all of you.